Thank you, Governor. Thank you for that update. Thank you all for tuning in. I want to also echo the Governor's appreciation to all of those who have been generous in this time, knowing the assistance that's needed, and also a special thank you to Rosa and Aunt Lydia for the beautiful masks that were given to the Governor and to me. So as usual, I want to remind everyone that the data the Governor referenced is all available on our COVID-19 data dashboard on the website of the Rhode Island Department of Health. Of the 16 new fatalities that we are unfortunately reporting today, 6 of them occurred yesterday, and 10 of these fatalities occurred in the days leading up to yesterday. The age distribution for the 16 people whose passings we are reporting today is 1 person in their 30s, 2 people in their 50s, 4 people in their 70s, 3 people in their 80s, and 6 people in their 90s. We want to extend our condolences to each of those families that are impacted. In terms of new cases, as the Governor also mentioned, we have 394 new cases. There are 271 COVID-19 patients currently hospitalized. Since the start of the pandemic, there have been 576 COVID-19 patients who have been hospitalized at some point. 315 of those people have been discharged home. Of the 271 currently hospitalized, 67 are in the ICU and 43 are on ventilators. Our total case count now is 5,500. I also want to note that at the bottom of our data page, we have a link to our historical COVID-19 numbers. As I explained the other day, there can be a lag of a few days between when someone passes away and when it is confirmed as a COVID-19 fatality. In that historical data set online that I just referenced, we have 6 fatalities listed for yesterday, even though the Governor and I announced that there were 16 new confirmed fatalities. So that people have the accurate picture of the arc of this pandemic, we've adjusted the historical data set we have online so it now reflects the date of unfortunate death of each person since the start of the pandemic, as opposed to the date that the death was confirmed. In addition to sharing that data update, I wanted to give a quick reminder about quarantine, isolation, and contact tracing. I'll again say that these are the tools that will be critical to helping us navigate our way out of this as we look to open up the economy. Having the expanded testing that we are doing a good job as a state in being able to access, we want to continue to make sure that we're getting to all of the communities for being able to be tested, and then also being able to implement as quickly as possible the contact tracing and quarantine and isolation elements. Rhode Islanders are doing an excellent job going out, getting tested if you have symptoms, so that we can continue to understand who all is out there and work with you to make sure that the proper steps are taken. When quarantining and isolation can happen, that is one of the most critical ways to stop transmission of the virus from one person to a new case. So many people have told me about their contact tracing notebooks that the Governor has charged everyone with doing, where you're listing the 5 people that you've contacted or been in contact with each day. We appreciate continuing to hear that. And so many people are sharing the creative ways that they're continuing to do what they need to do while also closely following the guidelines that we are sharing each day. I say often that everyone has a role to play in successful public health, and it is so true now. One area that we can start to focus on even a little bit more is to really make sure that we're following the quarantine, isolation, and contact tracing guidance right away. The sooner it can be implemented, the more effectively we can stop transmission of this virus. If you're told that you need to quarantine, make sure that you do that right away. It's being able to stay at home and monitor yourself there for symptoms, because it decreases the chances that you are out in public and sometimes unknowingly passing the virus on to someone else. If you have symptoms, it's critical to isolate right away, safely, but to be able to do that. Sometimes even little lags in time can have huge implications in terms of transmission of COVID-19. And we are doing a good job, but want to be able to share the reminder that if you are asked to quarantine, you should. If you have symptoms, whether or not you have been tested, you should isolate. And it's critically important to tell the people that you have close contact with. Tell the people in that notebook, I'm getting a test because I'm having symptoms, or I'm having symptoms, whether or not you've been able to get that test, so that you can give them the heads up even before we reach out to call. As soon as people understand it's important to be able to stay home, the sooner that can happen, the more effectively we can do as a state in decreasing transmission. So if you have symptoms and you're wondering, go ahead and call your provider and get the process going to get tested. But also, you can start with contacting the people in your contact tracing notebook. Let them know, I'm having symptoms, so I'm going to isolate and stay home and recover safely while talking to my healthcare provider or calling the urgent care center, because you're calling before going to any healthcare facility. But it's helpful to let those close contacts, either people who are in your household or other people who are in your contact tracing notebook or that you know you've been in contact with, to let them know so that they can also start to stay home and be more cognizant of the importance of quarantining. That's something that we can all work on together, and we'll continue to provide the support. And you'll always get a call from the Rhode Island Department of Health, particularly if your test comes back positive. But everyone understanding the importance of that process taking place as early as possible is something that helps everyone as a whole in terms of stopping the transmission of the virus. Lastly, I want to just reiterate a theme I've been talking about for a few days, which is addressing and achieving health equity and eliminating health disparities so that we can ensure that all communities from every zip code in Rhode Island have an equal opportunity to be healthy. The governor and her team, which I'm honored to be a part of, are all absolutely committed to health equity. She's asking me and the other members of our COVID-19 response team every day about what else we can be doing to get resources and supports to the communities where they are needed most. We're going to keep this up as we look forward and start thinking about the new normal and about where we will be in the next 3 months and 6 months and beyond that. We're taking this approach across state government with leaders like Director Scott Jensen, that's been mentioned, Director Hawkins, Commissioner Infante Green, Secretary Pryor, and so many others. We are going to be working with cities and towns and communities as well to help make sure that each step as we go forward takes into account health equity, making it so that regardless of the zip code anyone is from in Rhode Island, everyone has the opportunity to be healthy and to restart our economy with the new normal, bouncing forward to an improved start. I've also spoken about the health equity zones in the past and talked about our Commission for Health Advocacy and Equity just yesterday. These are all partners that we're going to work with together to help make sure that the community's voice is amplified and heard as we work to get Rhode Island back on its feet again in a way that takes into consideration the needs of all communities in the state. So we are committed to that together with you.